A pleasant evening and a warm welcome to the national news live on Channel I. I'm Dilanjali Ananda.
Good evening, I'm Clifford Richards. First of all, we take a look at the headlines.
The GCE Advanced Level Examination begins, subjected to health recommendations. The Public Services United Nurses Union says the strike in the health sector is unreasonable and causes obstructions to the patients. A striking progress in the number of persons receiving the booster vaccine. 3 workers killed in Kandy due to falling off an earth mound.
For those and other stories in detail. The 2021 GCE Advanced Level Examination has commenced today according to the health guidelines. The total number of candidates sitting for this year's examination is 345,242. Out of this number, 279,141 are school student candidates and 66,101 are private candidates. The examination is being conducted in 2,438 centres throughout the island. 29 hospital-related centres are being operated on behalf of COVID-19 infected students. Any candidate who becomes positive to this disease 7 days prior to the examination date is able to appear for the examination from a special centre. Exam centres have also been set up and intermediate treatment centres as well. Commissioner General of Examinations LMD Dharmasena said that a problematic situation has not been reported from any part of the island. He has made a special request from COVID-19 infected students as well as their parents not to come to the regular examination halls. The Commissioner General has further stated that a COVID-infected student in an exam hall may be under mental pressure. Therefore, he has requested to immediately hospitalize such candidates. This is not a harassment perpetrated on the student. The Commissioner General has assured that any student afflicted with the disease will be looked after in the proper manner by the physicians. The 2021 GCE Advanced Level Examination was unable to be conducted in August of last year due to the prevalence of the corona disease. Accordingly, the postponed examination will be conducted until the 5th of next month.
A work stoppage commenced by several nurses' trade unions continues. As a result, patients who have arrived to receive treatment were subjected to severe difficulties. 18 amalgamated trade unions comprising of nurses' services, supplementary health services and paramedical services are engaged in the strike. However, work stoppages are not being conducted in 9 main hospitals and in 1 other health institution. Yet many services including antigen testing have been obstructed due to the trade union action. The strike is being carried out based on several demands including salary anomalies. President of the Public Services United Nurses Union, the Venerable Muruthettuwe Anandathero says his union is not extending support to the strike. The President of the Public Services United Nurses Union, Venerable Muruthettuwe Anandathero said that there have been many problems affecting the nurses' staff. The Venerable Thero had recalled that the leader of the Nurses Union has functioned as a parliamentarian during the previous regime and was closely connected to the former health minister. But he was unable to fulfill the needs of the nursing professionals. He said that the nursing staff must realize the dual nature of this individual. He is misguiding the nurses. The Venerable Thero further stated that his union was able to win 4 out of the 7 demands of the professionals through discussions with the President. He added that he has conducted talks with the President this morning as well. In 1 month's time, nurses' universities will commence operations. Venerable Muruthettuwe Anandathero has called on the nurses' profession to place their confidence on his union and the President and the Prime Minister and also the Minister. Another demand of the nurses will be fulfilled next month. That is the provision of a 20,000 rupee official uniform allowance.
තබන්න අගමැතිතුමා කෙරෙහි විශ්වාසය තබන්න ඇමතිතුමා විශ්වාසය තබන්න අපේ ජයග්‍රහණය ඒකාන්ත වශයෙන්ම ලැබෙනවා කියන එක මම වගකීමකින් යුක්තව ඔබට මේ අවස්ථාව ධාරණය කරනවා. තව පොරොන්දුවක් ඉෂ්ට වෙනවා මාර්තු මාසේ රුපියල් 20000ක නිලැඳුම් දීම නාමක් ලැබෙනවා. මේක ලැබෙනකොට සියලුම නිලැඳුම් දීම ලැබෙන්නේ නැත්නම්ත් මේක වැඩි වෙනවා. නමුත් මේ අවස්ථාවාදී බංකොලොත්කාරයින්ගේ වර්ජන වලට මුවාවි වර්ජනක මුවාවිමින් වැඩවර්ජනය කිරීමෙන් වෙන්නේ මොකද්ද? අපට ලබා ගන්න තියෙන එකක් නොලැබී යාමට කිසියම් රුකුලක් ඉනිමකක් වෙනවා කියන එක තමයි මට කියන්න පුළුවන්කම තිබෙන්නේ.
මේ වෙලාවේ උසස් පෙළ විභාගය
President of the Government Medical Officers Forum, Dr. Rukshan Bellana, says that it is extremely clear that the strikers were trying to realize their political ambitions at the time of conducting of the GCE A-level examination. These trade unions are contemplating on political appointments. He's also suggested of convening an all-party conference and draft stringent legislation.
සර්වපාක්ෂික සමුළුවක් වගේ කැඳවලා මේ සෞඛ්‍ය ශාස්ත්‍රයේ වැඩවර්ජන නවත්තන්න ඒකාමේ නීති සම්පාදනය කළ යුතුයි.
National Television inquired from Health Ministry regarding the salaries received by the groups engaged in the agitation. It has been pointed out that despite the curtailment of overtime payments to state employees, these workers are permitted to receive overtime payments exceeding 150 hours. Accordingly, the salary grade of a grade 3 officer in the supplementary services is 78,030 rupees, including overtime payments for 150 hours. The salary of a grade 2 officer is 89,140 rupees, with the overtime payments for 150 hours. The Health Ministry further says that the stated salary of a grade 1 officer is 103,970 rupees. A super grade official could earn a salary of 117,290 with the 150-hour overtime payment. The salary of a special officer with the 150-hour overtime payment is 123,150 rupees.
The health divisions say a higher tendency is being witnessed among the general public to get themselves vaccinated with the booster dose. More than 460,000 persons were reported to have been inoculated with the booster vaccine from the 1st of this month until yesterday.
The difference between the vaccinated and unvaccinated person is vaccinated person possesses a certain level of immunity against the infection, and therefore the likelihood of getting into complications or likelihood of dying from infection is relatively low for the immunized or vaccinated person. In relation to that, the unvaccinated person is more likely to get complications, or like the risk of dying is relatively high compared to the fully vaccinated person. And also because of the high immunity, the vaccinated person's likelihood of spreading the virus is relatively low, and unvaccinated persons, since his immunity is relatively low, the likelihood of spreading the virus into the environment is relatively high. And as a result, we need to protect both vaccinated and unvaccinated persons. To protect the unvaccinated persons, we need to discourage them going into the public places unless it is essential. So therefore, this type of legal measures may help to protect the unvaccinated person, and also if the unvaccinated person infected with the disease and goes into a public place is more likely to spread the disease, and therefore to prevent or protect the vaccinated people from getting infected also. This kind of measures are important, and therefore scientifically what is required is to make sure that the unvaccinated persons are not going to spread the disease among the vaccinated people, and also unvaccinated people are not going to acquire the disease in public places, and thereby risking their lives can be minimized by this type of legal measures. The details of how it going to work will be informed by the Director General of Health Services or the officials handling this part of this activity from time to time. So until such time, I would like to say that anyone who has not so far taken the third dose of vaccine or the appropriate vaccination, please start getting their vaccination as early as possible, so that at the time of implementation you will be in a convenient position.
As of today, the coronavirus infections and the number of cases and the deaths are escalating day by day. In these situations, as government medical officers and associations, we have formulated how we are going to face the Omicron, the new variant which is emerging to the country, and how it can be prevented by the action of the health authorities and the citizens of this country. So that it is our duty to get the booster vaccine as early as possible. Now, the Ministry of Health has launched the program to administer the booster vaccines for the population above 20 years. And also, as a health authority, we reiterate the public to adhere all these health guidelines strictly in order to prevent the spread of the disease further, which will devastate country in future. So, as Government Medical Officers Association, we request all the citizens to get the booster vaccine as early as possible.
The total number of doses of vaccines inoculated on the people in the country under the COVID immunization program has been 36,581,500 persons. The first dose has been delivered on 16,788,517 persons. The number of persons who have received both doses of the vaccine is 14,015,145. The booster dose has been delivered on 5,777,838 persons. The Director General of Health Services have confirmed 26 COVID-19 related deaths which have occurred yesterday. 18 of the fatalities were of the age of 60 and above. 6 victims were between the ages of 30 and 59 years, and the remaining 2 fatalities were below the age of 30 years. The government of Israel has donated a stock of medical equipment to be used in the treatment of COVID-19 patients in Sri Lanka. Israel Ambassador in Sri Lanka, Neo Giglong, has handed over the items to the Foreign Secretary Admiral Professor Janat Kolambage. They have been donated by the Israel Representative Institute on International Development Cooperation. President Gotabaya Rajapaksa and Prime Minister Mahinda Rajapaksa have presided over a meeting of the government of parliamentary group at the Temple Trees this morning. Attention has been focused at the meeting on the parliamentary programs in the coming week and also on the present situation in the country. Discussions have been also conducted on many other issues, including resolution of the power crisis, usage of renewable power sources, as well as on enhancing of export-oriented economy. President Gotabaya Rajapaksa has also pointed out on this occasion on the need to focus more attention on renewable power. Minister of Finance has made a special explanation regarding the program being implemented to increase the export income of the country.
3 persons have been killed due to falling of an earth mound in Madavala in Kandy this evening. Well, 4 persons who were engaged in digging a drain for the construction of a wall of a house met with this accident. The residents of the Wattegama police station offices were able to rescue the workers from the rubble. Our correspondent says that, however, 3 of them have died before admission to the Katukasura hospital. The victims were residents of Panvila, Pujapitiya and Katabulawa.
Thusita P. Wanigasinghe has been reappointed as the Chief Secretary of the Eastern Province. He has received his letter of appointment from President Gotabaya Rajapaksa at the President's office this afternoon. Mr. Wanigasinghe is a senior official of the Sri Lanka Administrative Service. He has functioned as the District Secretary of Kegol and Ampara districts. It was in December 2019 that he was first appointed as the Chief Secretary of the Eastern Province. Thusita P. Wanigasinghe had also held many high-ranking positions in several state institutions.
Foreign Minister Professor G.L. Paris has met Indian Foreign Minister S. Jaishankar at the Foreign Ministry in New Delhi today. Well, several issues of bilateral importance were reported to have been discussed on this occasion. Sri Lankan High Commissioner in India, Milinda Moragoda, and senior officials of the Sri Lanka High Commissioner's office, as well as the Ministry of Foreign Affairs, have also participated at this meeting. In addition, Indian Foreign Secretary Sriharsh Vardhana Shringala and Indian High Commissioner in Sri Lanka Gopal Bagle and senior officials of the Indian Foreign Ministry were also present at this meeting.
This year marks the 65th anniversary of the establishment of China-Sri Lanka diplomatic relations. The anniversary celebrations, along with Sri Lanka's 74th Independence Day commemoration, were held at the Sri Lanka Embassy in Beijing this morning. Ceylon-China Rubber Rice Pact, signed in 1952, was the cornerstone for both the nations, which paved the path to enter into formal bilateral diplomatic relations in 1957. Prime Minister S.W.R.D. Bandaranaike and Chinese Premier Zhou Enlai signed the documents which established diplomatic relations between the two nations. Premier Chow En-lai had been a special guest at the Independence Day ceremonies in the same year. Sri Lanka's ambassador to China, Dr. Palitha Kohona, said that China since then and up until now has remained to be a close friend to Sri Lanka. A significant feature of this relation is the mutual understanding and the ability to rely on each other in difficult and challenging times. The ambassador commended the assistance extended by China for Sri Lanka's way forward and development efforts amidst the corona outbreak. A Chinese delegation attended the celebration.
Women's Federation meetings of the Sri Lanka Podujana Peramuna are being conducted throughout the island on electorate level, adhering to health guidelines. The meeting of the Women's Federation of Mirigama was conducted yesterday under the leadership of Kokila Gunawardena. Chief guest on the occasion was former Governor Kumari Balasurya. A group including representatives of the Mirigama Women's Federation were present. Minister Rohitha Abegunawardena presided over the SLPP Panaduru Women's Federation meeting yesterday. Many party activists attended the Peramuna's Women's Federation meeting in the Colombo North Electorate yesterday as well. The meeting of the Minuangoda Electorate Sri Lanka Podujana Peramuna Women's Federation was held at the Reji Ranatunga Memorial Hall in Minuangoda yesterday. Former Governor Kumari Balasurya presided. A group including State Minister Kanaka Herath was present at the Rambukkana Electorate SLPP Women's Federation meeting yesterday.
The Minister of Education says that deadline on the acceptance of applications to obtain interest-free student loans to pursue a degree is on the 15th of this month. The loan disbursement could be used to follow an approved degree course from a non-governmental higher education institute. The credit scheme has already been implemented under several stages. Under the 6th stage of the project, students who have passed the GCE Advanced Level Examination in the years 2018, 2019 and 2020 are eligible to apply. Applications should be submitted only through the online platform. The relevant website for applying is www.studentloans.mohe.gov.lk. Information could also be obtained through the telephone numbers 0703 555 970 to 979.
Well, on that exciting note, it's time to end the news. Do enjoy the rest of the program. Take care. Good night and stay safe.
Good night.